Tristan. My name is Emma. I'm going to be your nurse practitioner today.
Hi, Emma.
Hi. Today we're going to be doing a cardiac assessment. So to start that, I'm going to have you actually lie down at a 30-degree angle against those pillows. Perfect. And to do this, I'm actually going to be going to take a ruler and be putting it at your sternal angle. Do you mind actually looking to the left for a minute? Perfect. With doing that, I'm going to actually identify Tristan's jugular vein. And at a 90-degree angle, I'm going to be taking either a piece of paper or a note card, and I'm going to be lining it up to Tristan's jugular vein. This should be at least less than 3 to 4 centimeters, which it is. If it's greater than 3 to 4 centimeters, actually it's going to be showing fluid overload, which in this case it's not, which is great. Awesome. So just look straight ahead for me again. I'm going to start actually palpating your carotid arteries, I'm actually going to listen for your carotid arteries first, excuse me. And I'm actually going to be taking the bell of my stethoscope, and I'm going to be listening Tristan's carotid arteries bilaterally, one at a time. I'm going to be listening to see if there are any bruits, which there are not. And if there are no bruits bilaterally, which there are not, I'm actually going to then palpate Tristan's carotid arteries one at a time. When I palpate Tristan's carotid arteries, I'm going to be feeling for any for thrills at all, which there are not, and making sure that the amplitude is at +2, which it is, and that's absolutely normal. And I'm going to be doing it to the other side too. I'm going to be feeling Tristan's carotid artery, feeling that there is no thrills, and that the amplitude is +2, which it is, and everything looks normal there. Awesome. Next, I'm actually going to have you sit up, Tristan, and I'm going to actually be feeling for any heaves or lifts on your chest. So by doing that, I'm going to be taking the finger pads, and I'm going to be placing them on your chest to feel if there are any heaves or lifts, which there are not. And then I'm going to actually be taking the palm of my hands and putting it back on Tristan's chest, making sure that there are no thrills or any vibration movements, and there are not, which is great. Next, I'm going to actually be identifying all the cardiac landmarks. So I'm going to be starting with the aortic landmark, which is in the second intercostal space right at the sternal border. The pulmonic landmark, which is the second intercostal space left of the sternal border. Erb's point, which is the third intercostal space left of the sternal border. The tricuspid landmark, which is the fifth intercostal space left of the sternal border. And then the mitral landmark, which is actually the fifth intercostal space in the midclavicular line. Then I'm actually going to be listening with the bell and as well as the diaphragm of my stethoscope. To start, I'm going to be listening with the diaphragm of my stethoscope at each one of these places. So the aortic, pulmonic, Erb's, tricuspid, mitral, and then last I'm actually going to be listening to his epigastric point, which is going to be below his sternum and right at the bottom of the xiphoid process here. And I'm also going to be listening to make sure that there are no abnormal sounds, any murmurs, which there are not. Next, I'm going to be listening with the bell of my stethoscope at each one of these points again to make sure that there are no murmurs or any adventitious sounds, which there are not. Awesome. Tristan, I'm going to have you actually lie flat down again and turn a little bit to the left, and the left lateral will come into position. I'm going to be taking my fingertips, and I'm going to be going around 7 to 9 centimeters left of the sternal border, 7 to 9 inches left of the sternal border. And I'm going to be finding the apical impulse with my fingertips. This apical impulse should be actually no more than 3 centimeters. If it is more than 3 centimeters, it's actually going to be showing some enlargement of the heart or like enlargement of the left ventricle. Everything looks great and feels great there, that point of maximal impulse. While he's lying there, I'm actually going to be listening again to that mitral valve to make sure that there are no murmurs there. And so in this left lateral position, I'm going to actually be listening in the fifth intercostal space, the midclavicular line again, which there are no adventitious sounds or any murmurs, which is normal. Now I'm going to ask Tristan to sit up. And I hunch forward a little bit, and just with the bell of my stethoscope, I'm going to be feeling at the aortic landmark. And he's going to be taking a big exhale, and I'm going to be listening for any murmurs while he's exhaling. Perfect. There are no murmurs. Everything looks great. Thanks, Tristan.
Awesome.